Hello, 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 hello. Good morning, good afternoon, good evening. How are you guys? I know, I know. It's been a long time. Today is March 15th, 2022. Today is 2 years since stem cell transplant. So Nadia is 2 years old. I know I've been gone a long time. A lot of you have reached out to me. Thank you so much for checking on me. I appreciate you guys so much. It's going to be kind of a long video. I just want to explain where I was, what I was doing. Um, so let's just jump right in, right? First, Happy New Year, Merry Christmas, Happy Thanksgiving, all that good stuff. Yeah, I missed a lot. So in November, on November 1st, well, let's back up. I know I needed to, so we all remember that I had a really bad spasticity problem, right? Really, really bad spasticity problem. And I was at max dose of baclofen. Wasn't really doing anything. I was working out, but if I couldn't penetrate the spasticity, it made no sense. So I needed to go to rehab. I needed to go to inpatient rehab. It's hard to go to inpatient rehab from home. It just is. So on November 1st, I worked the full day, and then I packed the suitcase and I went to the hospital. Went to the hospital, told them about the spasticity, about rehab, got admitted, was in that hospital for 9 days. So I was in hospital for 9 days. They did give me a steroid to try to calm the spasticity. It didn't. It helped initially, like it helped the first 3 days on it, and then the spasticity ramped up and ramped up. And I was still taking the highest dose baclofen. So I spent 9 days there. While I was there, they were trying to get me into different acute rehabs. Finally got a rehab that I agreed to go to because I just wasn't going to go anywhere because I don't know anything about inpatient rehab. I was nervous. I didn't know what to expect. Went to inpatient rehab. So on November 9th, I left the hospital and went down to inpatient rehab. It's pretty far from my house, like an hour and 20 minutes from my house. Had never even heard of this part of my town, of my state. Go to rehab. Super nervous. Like you get to this place and you see mostly elderly people, and I'm like, ugh, okay. But it's like highly recommended neuro acute rehab place, and I'm like, oh, what is this getting ready to be like? So I'll get there, and first, can I say, let me back up to all the people on 4 West at Virtua in Marlton. Hi, you people. Thank you so much for taking such excellent care of me. Thank you. I Thank you. I don't know if there was a word more than thank you, I would use that word. It was my birthday when I was in hospital, and every time they come in your room, they ask for your date of birth and your name. They shoot your arm bracelet. So I didn't even say anything. I just said it casually, like my date of birth 11/4 and my name, and the nurse was like, that's today, and I was like, She was like, today's your birthday? I was like, yeah. She said, you didn't say anything? I was like, well, what was I supposed to say? So they bought me flowers, like they did a whole miniature birthday party in my room, COVID safe. um it was just awesome. Okay, so back to on the 9th, I go down to the rehab, and I'm getting wheeled in or whatever. It was just a whole flurry of where's the paperwork from her, a whole bunch of stuff. And I'm a little tired at this point because it's a long drive, and I was already tired from the morning. And Juan, my nurse, my forever nurse, Juan Garcia, who I love, 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 looked at me, and everybody was talking around me. And he was like, sweetheart, have you eaten? And I was like, no. And he was like, I'm going to get you something to eat. And in that moment, like when he humanized me, I knew it was going to be cool. So I'm in rehab. I'm doing PT 3 hours a day, 4 hours a day, 3 hours a day, sometimes 4 hours a day. Every day, Monday through Friday, doing PT, stretching, up, in a machine. There's this machine that you get in and it moves your legs for you. I don't know how to. I think I'm gonna. I have footage of it. I'm gonna try to insert it. I don't really know how to do that, but I'm gonna see if I can try. But so you're on this machine. You lay flat on the table, and then they lift you up, and the machine is moving your legs, and the objective is to break up the spasticity, right? Went on that, and then there's another machine that you put in the hallway, and you get into a harness and you move your legs like you walk with it, but the machine helps you glide, like it lifts you up a little off the floor and then helps you glide. So going through all that, my regular doctor, that I had, because every day you see two doctors. You see an acute neuro specialist and you see a regular physician. And you see all these nurses, and it's just crazy. But it was a really good time. Like, I was there for 4 months, and I wanted to come home, but I didn't want to leave the people. That's how good they were to me there. So I'm doing PT, but my spasticity is not getting any better. So the PT is not really beneficial because of the spasticity. So my doctor happens to be on vacation, and the director of medicine is doing rounds and says to me, "You would be a good candidate for a baclofen pump." Well, I had already asked my regular neuro about a baclofen pump, and I had done a bunch of research, because at this point I'm on max dose baclofen, and the only thing it's really doing is making me tired, and maybe it lasts for about 15 minutes to relax my legs, but then the spasticity is back again. And he told me I wasn't a candidate for it because I didn't need it in my left leg, I needed it in my right leg, and it wouldn't be able to differentiate. Now, I wasn't even thinking at the time, but later, my PT, my Kristen, she was my PT there, says to me, "Well, when you were taking it orally, did it differentiate between the left and the right?" And then it made so much sense. So Dr. Amith, who's the director, the medical director, said I would be a good candidate. So you have to schedule a baclofen test where they shoot the baclofen with the needle into your spine, a certain dosage, 25 was the micrograms, and to see if it loosens your legs. Well, it did. I was the perfect candidate for that, because when they shot the 25 micrograms, you could pick up my legs, bend my legs, anything you wanted to do with my legs. I couldn't stand with it because my legs were too loose, because you do need some level of spasticity still to stand. But after the test, it was like all go. This was in December now. Now, mind you, I've been there since the beginning of November. So it's like, okay, let's get a go. Dr. Amith, who is my doctor at rehab, happens to be friends with the doctor at Cooper who can do the surgery to put the baclofen pump in. He wasn't taking any more patients for the rest of the year, but Dr. Amith made a call, got me in. I'm hype. I'm going to get a baclofen pump. So now I'll be in rehab and everything will be good, because the exercises that I'm doing will help, because the spasticity will be gone. Well, I'm scheduled for surgery that Thursday. On Monday, before surgery, to put the baclofen pump in, Dr. Amith calls me on my cell phone. Now, he's the director, calls me on my cell phone and apologizes. He had to cancel my surgery. I'm like, well, why did you cancel my surgery? He has COVID. I'm like, oh my God. So because I'm exposed to COVID, the other hospital now won't see me until I test negative 14 days in a row, which I tested. I probably got 50 COVID tests while I was there and never got COVID. And other people around me got COVID, so I'm grateful. So surgery's now pushed back. I can't get it in the month of December. I am pissed off. I'm so pissed off, because now I'm back to doing fruitless PT 3 to 4 hours a day. PT and OT 3 to 4 hours a day. And let me stop saying it was fruitless. It wasn't fruitless, because it was strengthening my body. Like, my muscles are out of control. Like, it was strengthening my body. So now Dr. Amith comes back and he makes another call, gets me pushed up to the first week of January. So first week of January we go. January 6th we do the baclofen pump, stay overnight at the hospital. They're taking me back to rehab now, because you have to go back to rehab. First, your pump has to have a specific number set, and being in rehab is how you'll be able to tell. So you can't have too high of a number. That's too much baclofen at once. It'll render my legs useless. Can't have too low of a number, not enough baclofen, too much spasticity. So we do the surgery January 6th, and probably the surgery was earlier that day, probably about midnight that night. I just started feeling pain. And not even at the site where they had put the baclofen pump. Maybe some of you don't know what a baclofen pump is. A baclofen pump is just like an insulin pump. Instead of pumping insulin into you, it pumps baclofen. Baclofen is the drug that relaxes your muscles and causes the spasticity to be less. So that night I started feeling pain, like up and down my spine into the back of my head, like pain like I have never felt before. And I'm pressing the buzzer and I'm like, no. Like, I'm in pain. Give me something for the pain. She gives me something. It doesn't help at all. So I'm just trying to calm down, not get overly excited, because when you tense up your body, it tends to hurt more. And she's calling the doctor now because she's like, you shouldn't be hurting like this. Hurting. So I figured out if I just lay down, like lay all the way flat, no pillow, no nothing, the pain goes away. Well, you can't just lay flat. You got to get up. You got to use the bathroom or whatever. The next morning they come, they get me dressed. I go back to rehab. I get back to rehab, and the movement in the ambulette going down, the movement getting me out of one stretcher back onto the bed. Juan, my forever nurse, oh my God, I love him so much. Juanito, he's there, and I'm not complaining. I'm super nice to everybody. I get along with everybody. Everybody loves me. I love everybody. I'm not crying about anything all that time because I'm working hard. When he saw me, I couldn't even talk. That's how bad I was in pain. Tears just were streaming. So he sees me and he's like, no, this is not Tanya. Something's wrong. But I'm still like, okay, maybe this is a part of getting the baclofen pump because you might be in pain or whatever. The next day, mind you, it's surgery. Like, they cut open my stomach. The baclofen pump is on the right side of my stomach, and the catheter goes around to the back of my spine. The drug is released through the catheter directly to the spine. The next morning now, it's time to go back to PT. No, correction. That was Friday. No PT Saturday, no PT Sunday. Monday morning, it's time to go back to PT. Well, I'm up, ready to go to PT. My regular time started at 9:15. Going to PT now, but my head feels like somebody has taken a metal bat and bashed me in the back of my skull repeatedly. No exaggeration. That's exactly what it felt like. And I'm like leaned over to the side, like I can't hold my head up, but I'm still trying to do PT because now I have this baclofen pump, and now let's get these legs stronger. Let's get moving again. Well, go to PT, and my PT is like, Tanya, what's the matter? And I'm explaining to her my head. Excuse me, I had to sneeze. I couldn't hold that. I'm explaining to her my head is just pounding, but I'm still up on the parallel bars. I'm still walking like on the parallel bars, taking steps, sit down, stand up. I'm still doing all my OT exercises until I stayed like that for a week. Sometimes I couldn't even leave my room because the lights in the hallway was too much, so we would do PT in my room, and I would sit up and do PT and then have to lay down flat to get the pain to stop. So then my other doctor's on vacation, Dr. Amith, and I get a new doctor. I can't remember her name right now. Oh man, but thank you so much. She saved me. So she comes in and she's like, what's the matter? Because at this point, I'm just crying, like, but I'm still getting dressed to go to PT. And she's like, what's the matter? And I'm just like, my head, I don't understand what's happening. My head is hurting. And so she looks at the chart. The medication that Dr. Amick put me on for the headaches to try to stop the headaches, well, the rebound effect was a headache. So the medication he was giving me was making my headache worse. So she took me off of that medication. She said, no PT, lay down, lay flat, do not get up past 30-degree angle. Eat like that, everything like that. The only time I didn't hurt was when I was laying flat, honestly. So I had what was called a spinal headache. So now I'm researching because now I have a name to put to it, and I'm reading it. And she's like, they should have let you lay flat for the first 5 days after the surgery. Well, nobody told me that. And I'm so grateful that I'm in the place where I know I can get the help that I need because of the spasticity, that I'm just doing PT. So the spinal headache has me flat. She didn't let me get up for 5 days. Nothing, just lay flat. Well, now I'm, the more you lay down, the more your body like deteriorates. They say for every day you lay down, it takes a week to get back to the strength you were before. So I'm like not wanting to waste time, not wanting to waste all this momentum. My body's stronger, my legs are stronger, but I can't do anything else. So finally, on day 3, they find anesthesiologist to do something called a blood plug, where they take your blood and then shoot it in your spine, because the idea is that it'll close off, it'll clot and close off whatever minor hole was caused by opening your spine for the surgery. So I go again in the ambulance to this doctor, and she tells me it should be over in like 3 days. And I'm like, well, if you don't have to stick another needle in my spine, I've just dealt with it for almost 2 weeks, I'll just ride out with it. So I rode out the last 3 days. Finally, headache's gone, I'm up, I'm feeling strong, I'm working in PT. So much so I would leave for PT in the morning, come back, like back to back to back PT, eat lunch, go back to PT, and sometimes I'm in bed 6 o'clock, I'm sleeping, 7 o'clock, I'm sleeping. Like, that's how exhausted I was. But still, I am in the middle of an answered prayer at that time, because I needed help. I prayed for help, and I got this help. So I'm not complaining at all. And the running joke was, people would be like, Tanya, you just might as well stay here. Like, because at that point, it's 3 months and I'm still there. Insurance is approving me. I'm grateful. The gratitude that I have for the insurance, although it's too expensive and I complain about it, I'm grateful. They get me an electric wheelchair, order it because insurance is going to pay for it. They get me new braces because I have a foot trap. Like, all these things are being done for me while I'm being worked out to maximum capacity. So finally, it gets to the point where I can go home, I can transfer from chair to bed, I can take steps, I can walk on the parallel bars up and down, back and forth. I still can't walk unaided. My spasticity is in a great place. We worked with the numbers, so every day Dr. Amith would come. There's this like computer you put on where the pump is, and you dial down the number, and every day after PT we would determine, did I need a little less, did I need a little more. I started at 70. It was too much. I'm at number 59. That's my number. I've been holding at that number for about 2 months now, and that's the number that works best for me. Finally I'm home. 4 months away. It was a long time, like every holiday at the end of the year, the new year, it was crazy. So that's where I've been. That's what I've been doing. The best news out of all of this, the best news is that I did a full workup in November at the hospital: brain, lumbar, thoracic, and cervical. No MS activity, no new lesions, no nothing. The stem cell transplant has worked. I have never had an MRI that didn't have anything on it before the stem cell transplant. So the stem cell transplant actually works. We are 2 years old today. That's where I was. That's what was going on. We have this baclofen pump. I cannot say enough about Bacharach. I cannot say enough about the people there. Tori, my aide Tori. This giant, he's tall. It's probably like 6'4", maybe 6'5", I don't even know. The nicest, kindest person. When I had my headache, he would pick me up out of the bed and put me on the commode like I couldn't do anything. He would help me get my showers. Everybody, Mr. Ed, Lisa, 2 Lisas, Kara, everybody, my Kristen, Claire, my OT. I just can't say enough about how awesome these people were. And everybody kept on telling me I was so inspiring and I changed their life. And they were so good to me. Like, they turned something that could have been dreadful, because people get depressed in places like that, and they turned and made it something wonderful. My son used to be playing in his ball games. Hey, Mia. And I would stream his games in my room. When he played like a 2-month stretch, Monday, Wednesday, Saturday, for like 8 weeks straight, 7 weeks straight. And every Monday, Wednesday, and Saturday, 3 to 11 shift would be in the room like Amir's playing. So Nicole, Okay, so the food, everybody knows I eat plant-based. Well, the food was a problem because when I first got there, they only had veggie patties and, beans and rice and vegetables. But at some point, I couldn't eat that stuff anymore. Like it was the same thing. And my body was like, nope. So I wasn't eating. And you could tell, like in my workouts, I wasn't eating because my body was weaker. So Claire made a call. And Nicole, who worked in dietary, they call every night, the night before, for what you want the next day. She made sure I ate. Nicole, you are an angel. She even went and spent money and bought things for them to cook for me. Like she stayed on them about what I was eating. She would make sure if it wasn't right, she would get on them. So they even went and bought the products that I use in my house, like Beyond Beef, Morningstar, things like that. They purchased those things to cook specifically so I could have food to eat outside of everything that the rest of the residents, patients, whatever, were eating. So I just, I'm so grateful. Like, I'm so grateful. I'm so grateful. I'm so grateful. And I appreciate, I'm just appreciative. Like, the gratitude is the treatment that I got was above remarkable. Jocelyn, hey. Rosemary, hey. I can't, like, I'm not intentionally forgetting your names. It's already 21 minutes and I hate long videos, so I don't want to be forever. But that's where I've been. Thank you to all you guys that emailed me. Thank you. Like, you don't even understand how we are strangers, but we're family. Because when you guys don't see me, emails start popping in. Hey, Tanya, are you okay? We haven't seen you. Or comments start popping on old videos like, hey, are you all right? Where are you? Thank you. Thank you, thank you, thank you, thank you. So for 4 months, I didn't see anybody I personally knew or loved because for COVID, you couldn't visit. Like my son came home for a couple of days for Christmas and he couldn't even come up and see me. So I was like by myself, but not by myself, like by myself from the people who I was familiar with, but with new family. So when you guys do stuff like that, like it is the most wonderful thing. So thank you so much. Thank you. Thank you. I'm back. I'm back. I'm back. I'm back. Have PT and OT coming to the house. So we're up. We're moving. I have a half wall in my house. We're walking side to side on that. We're still working. Every day I do the PT that they taught me. Every day I lift. Every day I do chair dips. Every day. Every day. So we have not stopped. We won't stop. We are still grinding. Most important thing to take from this, outside of how lovely strangers were to me and how I love them now and they love me, is that the HSCT worked. I have no new lesions, no progression, nothing. Nothing, nada. The spasticity has been a problem. It's old. It's not new. It worked. It was not in vain for me. I am glad I did it. I'm 2 years old today and I'm happy. So we'll be making videos again. I'll do better. I know I didn't do that well last year. It's a crazy time. You guys are all right? You guys are hanging out okay in this COVID, in these gas prices that are mortgage payments? You guys okay? Hope you guys are okay. Let me know you guys are okay. I'm back, you guys. Thank you. Thank you. Thank you.